Hi there, it's Marcia again. Today we're going to be talking about asthma education and maintenance. So let's start by going over some of the guidelines from the National Asthma Education and Prevention Program, also known as the NAEPP. So the purpose of the NAEPP. The National Asthma Education and Prevention Program was initiated in March 1989 to address the growing problem of asthma in the United States. The goals of the NAEPP are to 1. Raise awareness of patients, health professionals, and the public that asthma is a serious and chronic disease. 2. Ensure the recognition of the symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals. 3. Ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment and education programs. To accomplish these broad program goals, the NAEPP works with the intermediaries, including major medical associations, voluntary health organizations, and community programs to educate patients, health professionals, and the public. The ultimate goal of the NAEPP is to enhance the quality of life for patients with asthma and decrease asthma-related morbidity and mortality. Now let's talk about the NAEPP objectives. For patients and the public, they want to increase public awareness of asthma as a significant public health problem, increase public awareness of signs and symptoms of asthma, improve the knowledge, attitudes, and skills of patients regarding the detection, treatment, and control of asthma, particularly in high-risk populations, define guidelines for effective asthma education programs, and to promote development, dissemination, and use of patient and family education materials. For healthcare professionals, the objectives would be increase knowledge, attitudes, and the skills of all health professionals regarding signs, symptoms, and management strategies for asthma. Encourage health professionals treating patients with asthma to adequately track and monitor patient status and to use objective measures of lung function. Assist and encourage health professionals, schools, and continuing education programs to include up-to-date and accurate information on diagnosis, pathogenesis, and treatment of patients with asthma. To promote and encourage the concept of active patient participation with the physician in the management of their asthma. Develop resources and materials for use by health professionals, and to promote research to answer unresolved questions about underlying causes of asthma and appropriate asthma treatment and management practices. So now let's talk about the recommended key clinical activities for the diagnosis and management of asthma. So we want to establish an asthma diagnosis. And the action steps we're going to take to do that are to use medical history and physical examination to determine that symptoms of recurrent episodes of airflow obstruction are present. Use spirometry in all patients greater than 5 years of age to determine that airway obstruction is at least partially reversible. We want to consider alternative causes of airway obstruction too. So, the goals of asthma therapy is asthma control. We want to reduce impairment, prevent chronic symptoms, require infrequent use of short-acting beta agonists, maintain normal lung function and normal activity levels. We want to reduce risk, prevent exacerbations, minimize need for emergency care or hospitalization, and prevent loss of lung function, or for children, prevent reduced lung growth. Have minimal or no adverse effects of therapy. So the goal of therapy is to control the asthma. To do that, we want to reduce impairment, prevent chronic and troublesome symptoms like coughing or breathlessness in the daytime, in the night, or after exertion. Require infrequent use, less than 2 days a week of an inhaled, short-acting beta agonist for quick relief of symptoms, not including prevention exercise-induced bronchospasm. We want to maintain near normal pulmonary function. Maintain normal activities, including exercise and other physical activity and attendance at school or work. Meet patients and families' expectations of the satisfaction with asthma care. We want to reduce risk, prevent recurrent exacerbations of asthma, and minimize the need for ED visits or hospitalizations. Prevent loss of lung function for children. Prevent reduced lung growth. Provide optimal pharmacotherapy with minimal or no adverse effects of therapy.